How I started with Turning Point was that John had made a decision to open a small rehabilitation center, and I was his wife, so I was helping him along with the center. And many times he would ask me to talk to the families because he could relate with the person who was addicted, and I could very much relate with the families and their struggles and their fears and a lot of the hopes that they had for their loved one. And I could bring a lot of reality from what I had experienced myself. So it just seemed like a natural transition where I was on the phone a lot. And so I was working a daytime job and then on the phones sometimes till 2, 3 o'clock in the morning working with families. And I felt such a great sense of gratitude to have that experience to actually be there for them. Because when I was going through it myself, it was my biggest challenge, is that I felt that no one really supported the families. And just over time, it seemed like it was taking up more time, but it wasn't time that I wasn't willing to spend. So it was just something that transitioned very easily. It was a win-win for both sides. The part that I find very rewarding when I work with families is that I always remember that initial call. I remember the first moment that I speak with them. I remember the heartache, the frustration, the anger. I remember the situation that the whole family has been put in because of the addiction. And the thing that I find very rewarding about it is I continue to stay with those families. I have some families at 5, 6 years into the recovery now. They're back, working, they're reconnected to their children, they're reconnected to their wives, their mothers, their fathers, they're better employees. And I never forget that first phone call. So for me, it's a transition where I see it right from start to what I don't consider a finish. I just consider a journey, and I'm part of that journey.
Okay, very good. So tell me now what Habitude is.
Habitude is something that over time we felt that addiction was something that everyone could relate to. Everyone had someone that they knew, someone they worked with, someone that they knew of that had an addiction. But there were many people without addictions that possibly face the same challenges, depression, anxiety, and we just started looking at our program as being something that anyone could benefit from. And we started to hear this from the gentlemen that finished our program, that they were very blessed to have been brought into our program because they felt that addiction may have brought them there, but it wasn't something that they felt everyone could benefit from this type of program. So Habitude really came from us trying to determine a word or a name that would describe more of what we did. And creating healthy habits and a positive attitude is something that we do, and we say one step at a time because it is really baby steps. It's following the compass and getting to where you want to go. And virtually there isn't one person walking this earth that doesn't want to create better habits and a more positive attitude on a daily basis. Habitude is creating healthy habits and a positive attitude, one step at a time. We believe that it's very beneficial for people to try and work towards changing their habits, and hopefully by changing their habits, they will help to create more positive energy around themselves, a more positive outlook on life. And we do believe that you have to do it one step at a time, and understand where your journey is about to take you. So for us, Habitude is really just looking at everything in life, eating habits, relationships, work habits, just daily habits, things that are either helping you to move forward with your life and also helping to support being in a more positive place. Over the years, I've worked with a lot of families and with a lot of clients. I worked with a lot of health professionals, and I'm starting to realize, I guess just through what we do and the Habitude program, is that a lot of people are looking more not at just stopping the addiction, but actually changing their lifestyle. I believe that Habitude fits well into that because for most programs, they're finding that doing the dry detox or doing something where it's more abstaining from the alcohol or the drug, the likelihood of them staying clean and sober after they're discharged is usually not too successful. I think Habitude works because it's more about changing your habits and your attitude, and that's what's going to help you to stay healthy in your own recovery and not just be clean and sober, but to actually have things around you that are feeding that recovery as well in a positive way. With addictions, we find that the individual is affected in many different ways, and the program that we run is called a biopsychosocial with a spiritual twist on it. And the reason why we sort of approach the addiction that way is that biologically or physiologically, their system's been affected by the alcohol or the drug. Psychologically, their emotions are usually steering the addiction. And socially, a lot of things have been affected by the addiction itself. So we believe in order to help a person to recover is that you have to address all three things, because all three things have been affected. The spiritual component comes with, getting that hop in their step and that twinkle in their eye again. And we believe that, at any particular moment, that's really where they have to make that decision not to drink or use again. And usually if you've taken care of, how they're physically feeling, how they're emotionally feeling, and socially how they're doing in their own recovery, and with that spiritual component, you dramatically increase their chance for success. Our belief is that Habitude, the Habitude program in general, is something that can be utilized in every walk of life. So I think that we're going to see a lot of employers, health professionals, maybe even, the penitentiary, or I guess it's not that. What's it called? Not penitentiary systems.
Corrections.
Corrections. Okay, so I'm going to start again. Sorry, take 3. Our belief is that the Habitude program is a program that could be utilized in various aspects of society. It can be used in employment, it could be used in family, it could be used in corrections, health practitioners definitely could take part in our Habitude programs with their own patients. We believe that a lot of the emotional and physical ailments that people suffer from are usually, part and parcel to not having good habits and having a really usually negative attitude towards whatever's ailing them. So I believe that the program that we're offering, the program that we think is just a natural transition into what society needs today is really going to be cutting edge stuff, and it's also going to be something that I feel will be raising the bar a little bit as to what people will start to expect, and I believe that they will want the Habitude program. The Habitude program is something that I'm very excited about. I know that it's going to make a difference. I know that one day our kids are going to look back at this legacy and be thankful that we implemented this program. I think that our kids are also going to be at a stage in their life when they're maybe my age, and integrated medicine and complementary medicine will just be a way of life.